My name is Selena. Some of you may know me as your classmate, but for those who don't, my name is Selena Lapham. I'm a student in the Respiratory Care program at Midlands Technical College, and my project is on oral care in mechanically ventilated patients. So I spoke to several respiratory therapists, and I also talked to some of our dental hygienist students here at Midlands Tech, since oral care is their specialty. Everything that I had gathered, the research shows that poor hygiene has a correlation with ventilator-associated pneumonia, which is called VAP. So as a multidisciplinary team in healthcare, we all have a part in preventing VAP in our ventilated patients. Nurses and RTs alike, depending on what facility you go to, some nurses just do the oral care, while some RTs do the oral care, and sometimes both of them interchangeably do the oral care. So my project focuses on preventing ventilator-associated pneumonia with proper oral care techniques. A lot of people, when they do oral care, something that I was noticing watching in the clinical setting was the teeth were being brushed, but not for the amount of time required for all the biofilm, which is stuff that develops on anything in the mouth. Getting that biofilm off, the brushing time wasn't accurate based on the research, and the oral mucosa and the endotracheal tube were being neglected during oral care. So the oral mucosa, the teeth, and the endotracheal tube, they all act as a fomite. Fomite is something that's a carrier, so all the germs, if you're not brushing the endotracheal tube, if you're not brushing the teeth, if you're not brushing around the mouth, all those germs, that biofilm and the microorganisms can grow, and they can go down into your lower airways and create ventilator-associated pneumonia. So today I'm going to demonstrate the proper way of how to perform oral care. Come on.
First, I go ahead and inspect the oral cavity and section above the endotracheal tube cuff, carefully removing all the excess oral secretions. Then I section below the cuff using the inline section, ensuring that my patient is pre- and post-oxygenated appropriately. If your patient's room doesn't have one, make sure you go ahead and get a oral care kit from the supply room. Most of the hospitals implement the Sage Oral Hygiene Kit by Stryker that you see here. This kit includes an oropharyngeal suction catheter, several suction swabs, and a dual-headed toothbrush like the one you see here, with bristles on one end and a suction swab on the other, as well as a yonker in the kit as well. You also want to ensure that suction is connected and working properly. You want to include that port on the suction to make sure that the pressure is between negative 120 and 150 millimeters of mercury. I also personally like checking the tube placement just to make sure that it's in the same place it was when I began. So this is one of the Sage oral care kits. Inside there's a solution full of sodium bicarbonate. That's the antiseptic used to clean the teeth. So I open one end of the package, and then I put my finger on that thumb area to where I can burst open that package full of the sodium bicarbonate, which we'll be using to clean the patient's mouth. And then make sure before you begin, you connect that suction port right there to the toothlet so you can begin. If your ETAT doesn't have a built-in bite block, OPA is a good choice, especially for your sedated, unconscious patient without an intact gag reflex. This will prevent the patient from biting down on the tube and biting on the toothbrush while you're doing oral care. Now, with everything in place, you can begin.